Hello everyone, welcome back. In today's video, we'll be discussing about the palmar aponeurosis, which is a very important SAQ of apna upper limb. This is very frequently asked, so make sure that you understand the palmar aponeurosis very perfectly. Talking about the palmar aponeurosis एक easy topic है और इसी टॉपिक के अंदर जो है फिर मैं वो अपने सारे डिजिटल साइनोवियल शीट और साइनोवियल बर्सास भी जो है वो हम अल्नार बर्सा रेडियल बर्सा भी जो है वो हम कवर करेंगे. सो टॉकिंग अबाउट द पाल्मर अपोन्यूरोसिस. Okay. Now, in palmar aponeurosis, what you have to tell is this term, the palmar aponeurosis term, is basically used for the entire deep fascia. It is used for the entire deep fascia, but to be precise, okay, but for the restriction we could say that it's the central part of the deep fascia, okay, which covers actually two things. What? First of all, the superficial palmar arch, which covers the superficial palmar arch, the long flexor tendons, and the terminal parts of the median nerve, the long flexor tendons, the terminal part of median nerve. So क्या क्या हमारे पास? Superficial palmar arch, the long flexor tendons, and the terminal part of median nerve. So palmar aponeurosis is term often used for entire deep fascia. It is better to restrict it to the central part of the deep fascia, which covers अपना superficial palmar arch, फिर अपना long flexor tendons and the terminal part of the median nerve. ठीक है. Now, there are some features of this palmar aponeurosis. Now, what are the features of the palmar aponeurosis? First of all, you can see that the shape of the palmar aponeurosis, it is triangular in shape. So, the palmar aponeurosis is triangular in shape. अब triangular तो obviously इसका एक apex और एक base होगा. Apex, base, then the medial and the lateral margins. Okay. So, now talking about the apex of the palmar aponeurosis is proximal and it blends with the flexor retinaculum. The apex हमारा blends with flexor retinaculum. ये सब points मैंने notes में include किए ही already, पर apex blends with flexor retinaculum. Flexor retinaculum हमने पिछले वीडियो में कवर किया है, ठीक है. एंड अपेक्स जो है वो हमारा कंटिन्यूअस है विद द टेंडन ऑफ द पाल्मारिस लॉन्गस. अपेक्स विद द टेंडन ऑफ द पाल्मारिस लॉन्गस. यहाँ पे इमेज में अच्छे से देख ही सकते हो कि जो हमारा अपेक्स है दैट इज कंटिन्यूअस विद द टेंडन ऑफ palmaris longus. So apex is proximal, ठीक है, and blends with the flexor retinaculum and it is continuous as a tendon of and it is continuous with the tendon of the palmaris longus. ठीक है. बेस की अगर हम बात करेंगे तो बेस जो है वो हमारा डायरेक्टेड डिस्टल ही है, ठीक है. बेस अगर हम अब देखोगे सो इट इज डिवाइडिंग इनटू सुपरफिशियल एंड डीप स्ट्राटा, ठीक है. बेस के बारे में ये पॉइंट्स का एक अलग से वो ही रखो तो बेटर है कि जस्ट अ मिनट. अब जो हमारा बेस है, ठीक है, द बेस को अगर हम देखेंगे सो द बेस इज डायरेक्टेड डिस्टली. इट डिवाइड्स इनटू एन सुपरफिशियल एंड डीप स्ट्राटा. बेस डिवाइड्स इनटू सुपरफिशियल एंड डीप स्ट्राटा. जो हमारा सुपरफिशियल स्ट्राटा है दैट इज अटैच्ड टू द डर्मिस. तो पहला डिवीजन हुआ दैट इज ऑफ द स्ट्राटा. सो फर्स्ट it divides into the superficial and the deep strata. Superficial is attached to the dermis. अब जो हमारा deep strata है that divides into the 4 slips. Second division into 4 slips. Slips कहाँ पे डिवाइड होता है? So at the अपना base of the heads of the metacarpal bones. कहाँ पे डिवाइड होगा ये? At the head of metacarpal bones. Head of metacarpal bones. ठीक है. अब each slip divides into 2 parts. ठीक है. Each slip further divides into 2 parts. That is which are continuous with the fibrous flexor sheath, and these slips are continuous with the fibrous flexor sheaths. Okay. So again explaining you. So अगर हम base की बात करेंगे so the base divides into superficial and the deep strata. ठीक है. base जो है हमारा superficial and the deep strata. Each deep strata, superficial strata जो है वो जो उसके ऊपर स्किन है उससे अटैच होगा. Now the each deep strata further divides into 4 slips. You can see this is happening at the head of the metatarsal bones. Sorry, metacarpal bones obviously. अपना ये हाथ है नॉट द मेटाटार्सल, सॉरी, यहाँ पे भी मेटाकार्पल बोन्स, ठीक है, एट द हेड ऑफ द मेटाकार्पल बोन्स, ठीक है। उसके बाद जो है वो हमारा ईच स्लिप फर्दर डिवाइड्स इनटू सुपर टू पार्ट्स, okay, and both the parts which blends with the fibrous flexor sheath. Now, what passes through the base is the digital nerves and vessels. So, the digital nerves and vessel passes through this, okay, digital nerves and vessels. Okay. From where does this pass? So this pass through the intervals in between the slips. They pass through the in between the intervals to the slips. ठीक है? So अब तक अपेक्स और बेस क्लियर हो गया होगा. अब अगर हम lateral और medial margin की बात करेंगे, from the lateral and the medial margin of the palmar aponeurosis, the lateral and the medial palmar septa passes. तो यहाँ से क्या पास होगा? सेप्टा पास होगा, which actually में which divides the palm into compartments. ठीक है. So this was entirely about the palmar aponeurosis, in which we come to know that a quick revision अगर मैं दूं तो palmar aponeurosis is triangular in shape. Okay. Talking about the apex is proximal and blends with the flexor retinaculum. ठीक है, it is continuous as the tendon of the palmar is longest. Talking about the base is distal. In the base, it divides into superficial and the deep strata. The superficial strata is attached to the skin, whereas deep strata divides into 4 slips at the head of the metacarpal bones. Okay? Each slip then further divides into the 2 parts, okay, and blends with the fibrous flexor sheath. You can see it is blending with the fibrous flexor sheath. Okay? Digital nerves and vessel pass through the intervals in between the slips. Okay? This is about the apex and the base. Medial and the lateral gives attachments to the medial palmar septa, the lateral palmar septa, which divides the palm into compartments. ठीक है. Function क्या है palmar aponeurosis का? तो the function is to fix the skin, ठीक है, improves the grip and protect the underlying nerves and vessels. Fix the skin, improves the grip and protects the underlying tendons and vessels. ठीक, ये सब लिखा है मैंने. Deep fascia of palm, more precise central part, covers the superficial palmar arch, long flexor tendons, terminal part of the median nerve and the superficial branch of ulnar nerve. इसको मैंने LTS स्क्वायर से याद रखा था, क्योंकि ये अगर आंसर लिखने के लिए है तो ऑब्वियसली लिखना पड़ेगा तुमको, किन किन चीजों को वो कवर कर रहा है. पाल्मार अपोनेरोसिस देखो, ट्रायंगुलर इन शेप, हैज अपेक्स, बेस, मिडल एंड द लैटरल बॉर्डर. Apex is proximal and blends with the flexor retinaculum, tendon of the palmaris longus. मैंने ऑलरेडी ये सब जो आपको डायग्राम में बता दिया है, but just for the namesake, I am reading the text out. Base distal divides into superficial and the deep strata. ठीक है, deep divides into the 4 slip opposite to the head of the metacarpal bone. Each slip divides into 2 parts which are continuous with the fibrous flexor sheath. Digital nerves and vessel pass through the intervals in between the slip. In the lateral and the medial margins, lateral and the medial septa pass, which divides the palm into compartment. And then the functions. Okay. And clinical is about the Dupincher contracture. I will just add the picture, just give me a minute. So I've added the image of the Dupincher's contracture. Now you can see this. This is apna Dupincher's contracture. So this is basically because of the inflammation involving the ulnar side of the palm. Okay? Inflammation involving the ulnar side of palm. ठीक है. It is अगर हम देखेंगे, there is thickening and contraction of the aponeurosis, because of which you can see that the proximal phalanx and later the middle phalanx, ठीक है, the proximal and the middle phalanx becomes flexed proximal and middle phalanx, and you cannot make it straight, so the fingers cannot be straightened. Mostly the involved finger is the ring finger. So this is the Dupincher's contracture. I have included in the notes also inflammation involving the ulnar side of the palm, thickening and the contraction of the aponeurosis. Proximal and the middle phalanx becomes flexed, cannot be straightened. Most commonly, ring finger is involved. Okay. Now, moving forward, the next topic which I have to cover is अपना digital synovial sheath and the ulnar and the radial bursa. ये इतना पूछा नहीं जाता, but it's important that you know that what is your ulnar bursa, what is your radial bursa. ठीक है, छोटे छोटे से टॉपिक्स है और इसी वीडियो में हम कवर कर रहे हैं. ठीक है, so talking about the bursas. ठीक है, so first of all the ulnar bursa, as you can very well see, this is entirely अपना ulnar bursa. Okay, now this is entirely अपना ulnar bursa. These are the digital synovial sheaths. ठीक है, and this is अपना radial bursa. Now talking about the ulnar bursa, the long flexor tendons, this is the tendon of the flexor digitorum superficialis and the flexor digitorum profundus. So the long flexor tendons, I guess मैंने notes में include नहीं किया है इसको, हाँ इसलिए just a minute, I'll add a page. Okay, so the ulnar bursa की अगर हम बात करते हैं, अल्नार बरसा के नोट्स है मेरे पास, हाँ ये रहे अल्नार बरसा. अल्नार बरसा जैसे मैं बता रहा था इस डायग्राम से, अगर ये वाला भी डायग्राम देखोगे, बस इसमें हाथ उल्टा कर दिया है. तो अगर हम अल्नार बरसा की बात करेंगे, सो इट एनक्लोजेस अपने लॉन्ग फ्लेक्सर टेंडेंस, जैसे हमारे फ्लेक्सर डिजिटम सुपरफिशियालिस and the flexor digitorum profundus. Now this sheath, if we talk about the ulnar bursa has अपना parietal layer and visceral layer, has parietal layer and visceral layer. Talking about the parietal layer lines the carpal tunnel, whereas the visceral tunnel is close in relation to the tendons. ठीक है, it appears that the tendons invaginate it from the lateral side. Talking about the अपना ulnar bursa, it extends up to 5 to 7.5 centimeters in the forearm downwards up to the palm. ठीक है, in the it extends up to the palm. अगर मैं ये point include करूँ तो extends up to the palm. Okay, after that, if you can see that the lower medial end is continuous with the digital synovial sheath of little finger. That is अपना lower medial end is continuous with the digital synovial sheath of the little finger. So this is अपना ulnar bursa. 5 points अगर मैं वापस repeat करूँ, अगर हम text पढ़ ले ulnar bursa का, so see, ulnar bursa encloses the tendon of the flexor digitorum superficialis and the profundus. ठीक है, while they are passing through the carpal tunnel. Sheath में parietal layer और visceral layer lining the carpal tunnel, lining the tendons. Synovial sheath extends 5 to 7.5 centimeters in the forearm and downwards up to the middle shaft of the metacarpal bones. In the lower end, that is in the medial lower end, continuous with the digital synovial sheath of the little finger. Radial bursa की अगर हम बात करेंगे, so radial bursa encloses the common sheath. Sorry, radial bursa की अगर हम बात करेंगे, so it extends up to the distal phalanx of the thumb. ठीक है, up to the distal phalanx of the thumb, and as you can see that it is synovial sheath around the tendon of the flexor pollicis longus. That is अपना radial bursa. Radial bursa के बहुत ही छोटे points है. Encloses the flexor tendon of the thumb, inferior extends up to the distal phalanx of the thumb. Next is the digital synovial sheath. Talking about the digital synovial sheath, you can see this is basically the digital synovial sheath. और अगर मैं इधर देखूं, इधर दिखा हुआ I mean, so this is your digital synovial sheath. बहुत ही कम पॉइंट्स है इसमें भी. The digital synovial sheath encloses अपना flexor tendon in the finger. ठीक है, flexor tendon से जो है वो finger में वो इसको वो enclose करता है. Digital synovial sheath of the index finger is continuous with the ulnar bursa, whereas of the thumb is continuous with the radial bursa. ठीक है, whereas the digital synovial sheath are separate for the इधर गलत लिखा है, digital synovial sheath of the ring finger. of the ring finger is continuous with the ulnar bursa, whereas it is separate for the index, middle and the ring nail little finger. Little finger is continuous with the ulnar bursa, whereas it is separate for the index, middle and the ring finger. Okay, just a correction. I'll repeat once again. जो हमारा डिजिटल साइनोवियल शीथ है वो इंडेक्स, मिडल और रिंग फिंगर के लिए अलग है, whereas for the little finger it is continuous with the ulnar bursa, whereas of the thumb it is continuous with the radial bursa. इस डायग्राम में भी देख ही सकते हो. That was just an human error. I apologize. Then to जो हमारे लिटिल फिंगर है दैट इज कंटिन्यूस विद द अल्नार बर्सा, हमारे थंब का जो है दैट इज कंटिन्यूस विद द रेडियल बर्सा एंड इट इज सेपरेट फॉर द इंडेक्स, मिडल एंड द रिंग फिंगर. ओके, सो आई होप कि आपको अच्छे से समझ में आ गया होगा पाल्मार अपोन्यूरोसिस एंड द bursas. In the upcoming videos, I'll be dealing with the superficial palmar arch, the deep palmar arch, एंड द फेशियल स्पेसेस इन हैंड. उसके बाद तो खत्म है चैप्टर. उसके बाद एनाटॉमिकल स्नफ बॉक्स. जैसे मैंने ओरिएंट इस चैप्टर का जो वो है मसल्स वाला पार्ट, उसी में मैंने बताया था कि टेक्स्ट बुक में बहुत बढ़ा दिया है पर उतना सा पढ़ने की जरूरत नहीं है. आई होप दैट यू हैव क्लियरली अंडरस्टूड दिस वीडियो. इफ यू हैव एनी डाउट देन प्लीज फील फ्री टू आस्क मी. यू कैन डायरेक्टली डीएम मी ऑन इंस्टाग्राम, या फिर आप इस वीडियो के कमेंट सेक्शन में भी डाउट डाल सकते हैं. आई विल श्योरली रिप्लाई टू इट. Make sure that you like this video, share this video and subscribe to my channel. Stay tuned for more such videos. Thank you.